For over 3 decades, I've walked the frantic halls of emergency rooms, witnessing countless battles between life and death. And what I'm about to share with you, you need to grasp with absolute clarity. The stark reality is this. For most individuals over 60, surviving a first heart attack when completely alone is a grim, uphill battle. This isn't to instill fear, it's a cold, hard fact. Nearly half of all heart attack fatalities occur before the patient even reaches the hospital doors. Why this tragic statistic? Because people freeze, they hesitate, they're gripped by panic, unaware of the simple yet profound life-saving maneuvers that can sustain vital blood flow just long enough for help to arrive. And the brutal truth, my friends, is unvarnished. Without this crucial knowledge, you could be gone in mere minutes. Every single day, I've seen patients brought into my ER, their lives needlessly cut short when a simple action or two at home could have rewritten their fate. That crushing chest pain, the sudden, desperate gasp for air, disorienting dizziness, the icy sweat clinging to their skin. By the time they arrived, that golden window of opportunity has tragically slammed shut. But here's the beacon of hope. There are scientifically proven techniques, straightforward actions you can perform right now, even if you find yourself utterly alone, that can dramatically boost your chances of survival. These aren't empty promises or internet myths. These are genuine strategies cardiologists impart to their own patients. In this video, I'm going to guide you through 7 indispensable life-saving tips every senior must ingrain into their memory to navigate a heart attack when no one else is near. These are the very actions I desperately wish every patient in my ER had mastered before their crisis struck. And trust me, you'll want to pay close attention to number 3. Its impact is so profound, research indicates it can literally determine whether you suffer permanent damage or walk out of the hospital alive. Most people remain blissfully unaware, but after today, you will be equipped. All medical references and scientific studies supporting these insights are meticulously listed in the description below. Before we delve deeper, a quick thought experiment for you. How old are you, truly? Share your age in the comments. I personally engage with and respond to every single comment, treating each one like a direct conversation in my clinic, so please don't hold back. Now, without further delay, let's unveil number 7 on our critical list. This is the very first step that could dictate whether you emerge from the shadow of danger. Tip number 7. Call emergency services immediately. Do not postpone. The initial paramount action when those ominous heart attack symptoms begin to surface is unequivocal. Dial emergency services without a moment's hesitation. Do not wait. Do not second guess. Do not convince yourself it's merely indigestion or that the feeling will simply dissipate. With every passing minute you delay, the irreversible damage to your heart muscle escalates. Cardiologists articulate it with stark simplicity. Time is muscle. The longer blood flow is obstructed, the more precious heart cells perish, diminishing your chances of walking out of the hospital alive. Research unequivocally supports this. The American Heart Association reveals that patients who summon emergency services within the first 5 to 10 minutes of symptoms enjoy survival odds up to 50% higher than those who procrastinate. Yet with heartbreaking frequency, many seniors tragically downplay their own symptoms. Studies lament that nearly 1/3 of individuals over 60 delay seeking help for over 2 hours, often out of a reluctance to bother anyone or a misguided belief they can simply tough it out. That hesitation, my friends, can be utterly fatal. Picture this poignant scene. A 68-year-old grandfather in Ohio, one quiet evening, felt an unsettling pressure in his chest. He rationalized it away, thinking it was just gas, sipped some water, and hoped rest would make it vanish. Hours bled into each other as he waited, praying for the discomfort to subside. By the time his daughter discovered him and frantically dialed 911, the damage had become tragically irreversible. Doctors later conveyed to the grieving family that an immediate call to emergency services might have saved him, potentially with minimal heart damage. This heart-wrenching narrative repeats itself thousands of times annually, a preventable tragedy. So, if you're over 60 and ever experience that crushing chest pain, sudden breathlessness, inexplicable nausea, or that chilling cold sweat, assume it's a heart attack until definitively proven otherwise. Grab that phone and dial emergency services without a second thought. Even if it ultimately turns out to be nothing more than indigestion, you've lost absolutely nothing. But if it is a heart attack, and often it is, you've just executed the single most crucial action to preserve your life. Recognizing this urgency and making that immediate call is your first pivotal act of survival. However, while you await the arrival of paramedics, what you do next can be equally instrumental in maintaining vital blood flow, buying you even more precious minutes. This brings us to tip number 6, a technique rigorously proven to keep oxygen circulating when every fleeting second weighs heavily. Tip number 6, chew an aspirin, if available and you have no known allergies. Once you've made that crucial emergency call, your next immediate action can literally bridge the gap between life and death. Chew an aspirin. Do not swallow it whole. Chew it. Why this distinction? Because aspirin isn't merely a pain reliever. It's one of the most potent clot-fighting medications you can acquire without a prescription. Heart attacks typically occur when a clot obstructs the vital flow to the heart muscle. Aspirin's genius lies in its ability to thin the blood and halt the clot's expansion, preserving some crucial flow until medical assistance arrives. The science is clear-cut. A landmark study published in The Lancet revealed that taking aspirin during a heart attack diminished the risk of death by an impressive 23% in patients. But here's the critical nuance. Speed is paramount. The quicker it enters your bloodstream, the faster its life-saving work begins. Swallowing a whole aspirin can take 10 to 12 minutes to break down in your stomach. Chewing it, however, fractures it instantly, allowing the active ingredient to absorb directly through your mouth and stomach lining within mere minutes. In a scenario where every second is a lifeline, those minutes can mean the difference between preserving vital heart muscle and ultimately preserving your life. Consider the tale of a 70-year-old retired bus driver alone in his living room when that familiar crushing pressure seized his chest. He recalled his doctor's fervent advice, reached for the aspirin in his cabinet, and chewed it while simultaneously dialing 911. Paramedics later confirmed that this simple act had maintained just enough blood flow to avert major heart damage. He walked out of the hospital 2 weeks later, alive, independent, a testament to preparedness. Yet this is where many seniors falter. They either neglect to keep aspirin readily available or hesitate due to uncertainty about its safety. If you possess an aspirin allergy, a bleeding disorder, or your doctor has specifically advised against it, then of course bypass this step. For everyone else, however, maintaining a bottle of uncoated aspirin in an easily accessible location is one of the most intelligent emergency safeguards you can implement. Physicians typically recommend one full dose, 325 milligrams, chewed at the very first indication of a heart attack. Envision it this way. Chewing that single pill is akin to dispatching a rapid response team to decelerate the unfolding disaster until larger reinforcements arrive. It doesn't cure the heart attack, no, but it can arrest the damage from spiraling uncontrollably. Acting swiftly with aspirin keeps the odds decidedly in your favor. However, surviving a heart attack when alone isn't solely about what you ingest. It's profoundly about how you command your physical self in those terrifying, critical minutes. And that, precisely, is where tip number 5 becomes undeniably crucial. Tip number 5. Loosen any tight clothing and sit upright to alleviate strain on your struggling heart. When a heart attack strikes, every single movement you make directly impacts the workload your heart is forced to endure. One of the simplest yet most frequently overlooked survival actions is this: release any restrictive clothing, and adopt an upright sitting posture. Seniors often underestimate how rapidly restricted circulation and poor body posture can exacerbate an already perilous situation. Tight belts, constricted waistbands, or snug collars compress vital blood vessels, hindering your body's desperate need to circulate oxygen-rich blood. This isn't merely intuitive wisdom, it's deeply rooted in physiology. During a heart attack, your heart is frantically struggling to pump oxygen through narrowed or blocked arteries. Lying flat forces it to labor even harder, especially for seniors with weaker lungs or pre-existing conditions like COPD.
By adopting an upright position, ideally at a slight angle with your back fully supported, you enhance airflow to your lungs, decrease internal chest pressure, and facilitate more effective blood circulation. A clinical review in the European Heart Journal underscored that positioning patients upright during cardiac distress helps mitigate pulmonary congestion, that dreadful fluid buildup in the lungs that makes breathing feel like suffocation. In essence, the precise way you position your body can quite literally be the determinant between gasping for air in panic and maintaining sufficient calm to survive until aid arrives. A 74-year-old woman in Florida, tending her garden, suddenly felt a gripping chest pressure. Instead of succumbing to panic and lying down, she instinctively moved to a nearby chair, unfastened her gardening apron and waistband, and sat deliberately upright while awaiting the ambulance. Her doctor later credited this wise decision with likely preventing her from fainting and collapsing before paramedics could administer oxygen. That subtle adjustment kept her heart from succumbing under the immense strain. It's a step so deceptively simple that many seniors overlook its profound importance, but it truly matters. If you feel those unmistakable signs, pressure, breathlessness, or that chilling cold sweat, sit upright, consciously relax your shoulders, and free your chest and waist from any restriction. Think of it as granting your heart precious room to breathe, a vital act of self-preservation. This adjustment buys you invaluable stability, but to further amplify your chances, you must actively maintain blood flow to your brain and heart when circulation is under attack. That brings us to tip number 4, a powerful physical action seniors can deploy in those desperate minutes before professional medical assistance arrives. Tip number 4, cough strongly if you feel faint. This can temporarily sustain blood flow to your brain. It sounds peculiar, almost too simple to be effective, yet in the throes of a heart attack, the act of coughing, yes, coughing, can sometimes be a temporary lifeline. Doctors refer to it as Cough CPR. The underlying principle is elegantly straightforward. When you cough deeply and with force, your chest muscles contract, your diaphragm compresses, and a surge of pressure builds within your chest. That pressure then forcibly expels blood from the heart and into the brain, crucially maintaining consciousness when your circulation is on the verge of collapse. Now, let's be absolutely clear. Cough CPR is not a substitute for professional medical treatment, nor is it a cure for a heart attack. However, it can be an invaluable bridge, buying you precious seconds if you feel faint, dizzy, or on the brink of passing out before paramedics arrive. Research published in the Journal of the American College of Cardiology demonstrated that repeated strong coughing during cardiac arrhythmias helped patients remain conscious and maintain blood pressure temporarily until emergency treatment could be administered. In some documented instances, patients managed to stay alert for several minutes simply by coughing every 2 to 3 seconds. Imagine this: a 69-year-old retired mechanic in Texas felt a sudden disorienting wave of dizziness during what would later be identified as a massive heart attack. Alone in his workshop, he vividly remembered the advice about Cough CPR. He began coughing forcefully, again and again, staying conscious until paramedics burst through the door. Doctors later confirmed those timely coughs likely averted his collapse and prevented brain damage before they could reignite his heart. The science is fundamentally simple.
Fainting during a heart attack stems from an abrupt drop in blood flow to your brain. By coughing hard, you essentially create artificial heartbeats, akin to manually squeezing a pump with your chest muscles. It's not a flawless solution, and it won't stop the attack, but it keeps oxygen flowing to your brain just long enough for help to take over. If you ever feel your vision narrowing, your head spinning, or your body growing limp amidst chest pain, immediately try this. Take a deep, restorative breath, then cough with all your might as if attempting to clear your lungs completely. Repeat this forceful cough every 2 to 3 seconds until the dizziness recedes or paramedics finally arrive. Consider it your personal way of manually keeping your heart in motion when it's desperately struggling. This unusual yet undeniably potent technique has, against all odds, saved lives. But once you've achieved a degree of self-stabilization, your next priority is ensuring oxygen effectively enters your lungs. That's where tip number 3 unfurls, another deceptively simple yet utterly life-saving habit every senior should master. Before we proceed, if you're finding genuine value in these crucial insights, please take a moment to tap that like button and ensure you subscribe and activate the bell icon so you never miss out on powerful health tips like these. Tip number 3. Unlock your door and keep your phone close by, ensuring help can reach you without delay. When a heart attack strikes, every fraction of a second is precious, not just for your body's survival, but for the swift arrival of those striving to save you. One of the most shockingly overlooked survival steps is also one of the easiest. Simply unlock your door and position your phone within arm's reach. It may seem minor, but in a crisis, this can literally be the difference between being discovered in time or being tragically trapped behind a locked barrier while irreplaceable minutes vanish. Here's the stark rationale. Paramedics are trained to force entry if necessary, but every additional barrier consumes precious time. And during a heart attack, as we've established, time is muscle. Studies grimly observed that for every 10 minutes of treatment delay, survival rates plummet nearly 10%. Imagine losing those life-saving minutes simply because help couldn't breach your entrance swiftly enough. Unlocking your door in advance eliminates that critical risk. The poignant case of a 73-year-old widower in Arizona serves as a stark warning. He managed to dial 911 after experiencing severe chest pain, but tragically collapsed on the floor before he could reach his front door to unlock it. Paramedics arrived within minutes, but were forced to waste invaluable time forcing their way inside. By the time they reached him, irreparable damage had already been wrought. Contrast that heart-wrenching story with the experience of an 80-year-old woman in Florida. She, with foresight, unlocked her door, kept her phone firmly clutched, and patiently remained in a chair by the entryway. Paramedics gained immediate access, initiated treatment without delay, and swiftly transported her to the hospital. She survived with only minor heart damage, a testament to her proactive steps. The second, equally vital component of this tip is simple. Always keep your phone within arm's reach, especially if you reside alone. Far too many seniors leave their phone in another room or tethered to a charger, inconveniently out of reach. During a heart attack, even a few steps can trigger collapse. Having your phone beside you ensures uninterrupted connection with emergency responders until help materializes. Some even advocate placing your phone on speaker, allowing you to follow instructions without the exertion of holding it to your ear. Think of it this way. Your phone is your lifeline, and your unlocked door is the essential bridge that accelerates aid to you. Together, they dismantle barriers and reclaim precious minutes you simply cannot afford to squander. Once the path for help is clear, the subsequent vital step revolves around maintaining your body's composure, calm enough to endure until that aid arrives. And that, precisely, is where tip number 2 makes all the critical difference. Tip number 2, take slow, deep breaths. This action significantly lowers stress on your heart and oxygenates your blood effectively. In the midst of a heart attack, panic is your most insidious adversary. When fear takes hold, your body catapults into fight-or-flight mode, unleashing a torrent of stress hormones like adrenaline. This unwelcome surge elevates your heart rate, spikes your blood pressure, and forces your already compromised heart to labor even more strenuously. That's why one of the simplest yet most profoundly powerful survival actions you can take is to consciously engage in slow, deep breaths. Deep breathing accomplishes two absolutely critical objectives. Firstly, it dramatically increases the influx of oxygen reaching your blood and brain, both desperately starved of fuel when circulation is severely restricted. Secondly, it sends a powerful signal to your nervous system to calm down, effectively dampening the surge of stress hormones that inflict additional strain on your heart. Research published in the Journal of Cardiopulmonary Rehabilitation and Prevention confirmed that slow, controlled breathing reduced heart rate and enhanced oxygen delivery, even in patients grappling with advanced cardiovascular disease. It's not a panacea, but it grants your body a vital fighting chance while you await professional help. A 76-year-old retired nurse from Michigan recounted her survival story, attributing it entirely to her unwavering focus on breathing. As the agonizing, crushing pressure in her chest intensified, she adamantly resisted the primal urge to panic. She sat upright, closed her eyes, and commenced inhaling slowly through her nose, exhaling even slower through her pursed lips, as if you're gently blowing through a straw. Aim for about 6 to 8 breaths per minute, slow, utterly controlled, and intensely deliberate.
This diaphragmatic breathing not only offers crucial support to your heart, but also anchors your mind, preventing panic from overwhelming you. Consider each profound breath as actively purchasing yourself more time. Time for oxygen to saturate your brain, time for your heart to ease its grueling workload, and time for paramedics to arrive. And if there's one final habit that seamlessly weaves all these survival tips together, it is the last and most absolutely critical one. The action at number 1. Research unequivocally demonstrates it can literally double your odds of survival. Tip number 1. Stay as calm and still as humanly possible. Any movement can tragically worsen damage during an attack. When a heart attack strikes, your primal instinct might scream at you to move, to pace, or even to foolishly walk it off. But that very instinct, my friends, can prove fatal. The paramount survival rule is this, etched in stone: remain as calm and as utterly still as you can. Every single step, every sudden, jarring movement compels your weakened heart to pump with even greater desperation. And during a heart attack, remember, your heart is already locked in a fierce battle for its very existence. By keeping your body perfectly still and your mind calm, you dramatically reduce the strain, conserve every precious atom of oxygen, and grant yourself the absolute best chance of surviving until help arrives. Science elucidates this with undeniable clarity. During a heart attack, the blood flow through your coronary arteries is either completely blocked or severely diminished. Any movement demands more oxygen from your heart muscle, but with its supply already tragically severed, that extra demand only amplifies the damage. A clinical study in the European Heart Journal observed that minimizing exertion during acute coronary episodes significantly reduced complications and improved patient outcomes. In simpler terms, seniors who maintained calm and stillness lived longer than those who thrashed about in panic. A 71-year-old farmer in Nebraska discovered this firsthand. While repairing equipment, he was suddenly struck by crushing pressure in his chest. His initial desperate thought was to climb back up the ladder to retrieve his phone. Instead, he heroically forced himself to remain exactly where he was and called for help from that spot. Paramedics later told him that unwavering stillness had prevented his heart from collapsing under the immense stress. He survived with far less damage than doctors had initially anticipated. Calmness isn't merely a physical state, it's a profound mental discipline. Panicking floods your body with adrenaline, sending your blood pressure soaring and tragically exacerbating the attack. By concentrating on remaining still and consciously practicing those slow, deep breaths, you effectively lower that hormonal surge and help stabilize your body.
Whisper this mantra to yourself: I've called for help. My sole purpose now is to remain still and breathe. This powerful mindset prevents rash, dangerous decisions, such as attempting to walk to the door or grasping for something across the room, actions that can trigger a fatal collapse before aid arrives. Picture your heart during a heart attack as a fragile engine sputtering on its last fumes. Every single movement revs that engine faster, risking it blowing apart entirely. Stillness, profound calmness, and conserving every precious ounce of energy are the keys to purchasing more time, a lifeline in those desperate moments. This is the ultimate, most potent habit. Do less, breathe more, and allow help to reach you. Collectively, these 7 invaluable tips forge a comprehensive survival map. And while you can never truly foresee when a heart attack might strike, knowing precisely how to respond can be the profound difference between heartbreaking tragedy and triumphant survival. And there you have it, my friends, 7 life-saving tips meticulously crafted that every senior must internalize to survive a heart attack when utterly alone. From immediately summoning emergency services to bravely chewing aspirin, loosening restrictive clothing, powerfully coughing when faint, unlocking your door, engaging in slow, deep breaths, and ultimately maintaining absolute calm and stillness. Each action a precious minute earned, minutes that can decisively tip the scales between life and death. Remember this profound truth: a heart attack rarely grants you a second chance. But if you act with swiftness, think with clarity, and adhere to these meticulously outlined steps, you can survive and live to embrace tomorrow. The science is irrefutable, but its power is only unlocked if you are prepared to act. Now, I eagerly await your thoughts. From where in the world are you watching this vital message? And do you maintain aspirin or another emergency readiness plan within your home? Share your answer below. We personally delve into and respond to every single comment because your unique story matters and your survival insights could genuinely illuminate someone else's path. Don't forget to tap that like button, generously share this video with your cherished loved ones, and subscribe for an ongoing stream of life-saving advice. Stay safe, remain prepared, and always remember, knowledge is indeed power, especially as we navigate life beyond 60. Should you harbor any further questions or wish to intimately share your personal experiences, do not hesitate to leave a comment below. We are perpetually listening. Thank you for watching, and stay vigilant.